erosive esophagitis, take one.
So when you have erosive esophagitis, what's happening is that stomach acid or some other thing is causing the lining of your esophagus to be eroded, leading to ulcerations, irritation, and potentially many other complications as well. So when you have prolonged exposure of your esophagus to acid, you develop first inflammation, which can become severe if the acid exposure is very prolonged, and even develop ulcers. So these ulcers can bleed, which can vary from mild microscopic bleeding that over time leads to chronic anemia, or life-threatening bleeding that leads to hospitalization. As those ulcers and inflammation heal, you can develop something called a stricture, or narrowing of the esophagus. This can also be very dangerous because food cannot pass and food gets stuck, which can be its own emergency, and it'll prevent you from eating. If it prevents you from eating, you can end up with unintended weight loss. If the acid is going all the way up into your lungs, you can get things like laryngitis or even things like pneumonia as well. So Barrett's esophagus is a changing of the cells of the interior lining of the esophagus. If you repeatedly expose your esophagus to stomach acid, the cells start to change into the cells of the intestine. When your cells change like that, that kind of puts you on the spectrum towards developing cancer of the esophagus or esophageal adenocarcinoma. So people who have Barrett's esophagus need regular endoscopies every 1 to 3 years to make sure the changes don't continue and progress towards cancer. So it's a very serious condition. Esophageal perforation is one of the most serious consequences of erosive esophagitis. It's when you develop a hole in the esophagus, and it can lead to severe infections and will require very serious surgery. One of the most important things you need to do is start taking medications that will reduce the exposure of acid in your esophagus. In addition to taking medications, you can also make many changes to your lifestyle that will reduce the frequency of acid exposure to your esophagus.